Welcome to the question and responses for becoming your own doctor. This is really going to be fun. Question 1 from D. Seraphin 4663. Please talk about debilitating cluster headaches. And these are devastating. So you've got to look at where the cluster headaches are from. Like if you look at the medical world, there is no solution. They don't know what causes it. They know that if you get oxygen or vasodilate, open up the blood vessels, that it tends to help. So let's look at the actual cause. When you're looking at, and these are debilitating. I mean, when my patients have had these, they literally have to lock themselves in a room and nothing alleviates it. A lot of the medications give you a headache that they use, such as Imitrex, one of the worst ones around. But let's look at this. Number one, you've got to get oxygen to that brain. This is why pure oxygen therapy helps. But it's not just lack of oxygen. It has to do with the efficiency of the blood. See, that brain burns 90% of the body's oxygen. So if you decrease from vasoconstriction or the blood's not healthy, or there's a problem with the cervical spine. Now, this is one of the things the medical world is completely missing. They know that 97% of all headaches come from the neck. Okay, this is one of the big triggers. And also there could be trigeminal nerve, which is one of the cranial nerves coming off of the brainstem. Just know that you've got to get your neck checked and corrected by someone that can take an x-ray, do a series of adjustments, take another x-ray, and shows that the body is getting corrected. Because you're looking, the brainstem doesn't stop at the skull, it extends the top portion of the neck. So any subluxation patterns up there are going to negatively affect it. So number one, you got to look at physical stressors. That neck and upper thoracic area are going to be absolute contributing factors for pressure on the brainstem. That is the main contributing factor to these headaches. 2, capsaicin or cayenne supplements. I've seen some studies where they can do it as a nasal spray, which massively vasodilates. It opens up and gets more oxygen to the brain. You can also mix a little cayenne with your water that you're drinking all day long. Again, fantastic, loaded with good nutrients, and it vasodilates. It opens up those blood vessels, and that's the key. Look at nasal diaphragmatic breathing, because there all can be a sinus contributing factor. This is why sometimes there's tearing, sometimes there's nose drainage, sinuses, because you've got those 6 sinuses. And if those are impacted and swollen up, it can literally move the facial structures and the structures of the skull. So look at the mechanical distortion from the upper cervical, mid-cervical, and upper thoracic area. That's going to be a contributing factor. Number 2, look at impacted sinuses. Now, that's going to be a gut issue. So ultimately, to correct the cause of this, physical stress, get that identified by some doctor that's going to do a second x-ray and document that they fixed the problem. Number 2, nutrients. Understand that if you have healthy blood, that little 1 kilo brain, 2-pound brain, burns 90% of the body's oxygen. So if your blood's not efficient based on stress, so that's poor diet. And this is why men are more affected with cluster headaches. They're going to be fast food, working, high stress, and they're not really taking care of themselves. So diaphragmatic breathing is going to help. Changing your sleep patterns is going to help. Getting your gut healthy is going to be hugely important. And then even a small little pain is going to trigger a massive emotional. I had this one gal who came down. I ended up making a poster out of her x-ray because it was horrible before. Got a second one and showed beautiful post. But she drove 2.5 hours. She would have cluster headaches like this, that she would lock herself in a closet. And she was a mom with 3 kids. And it was just devastating to her. Finally, she made it down to one of our offices. Within a month and a half, the headaches were gone. And they were gone for 1 month, 2 months, 3 months, 4 months. And we're getting great changes. Then she had a reoccurrence. And this was a reoccurrence based, again, what's it based on? Stress, physical, chemical, emotional stress. 6 months down the road, she calls me up. She says, I just want to kill myself. I can't go back to that. And I told her, it's kind of like talking someone down in an airplane. No, baby, you can land this thing. Okay, don't worry about it. Okay, get the neck curve exercise that we talked about. Get some cayenne supplements. Drink some more water. Do the nasal diaphragmatic breathing. Okay, You're going to be calming that system down. Okay. And then, sure enough, the pain, I just want to communicate that the cluster headache is so freaking debilitating. But the solution is so accurate. You restore the curve of the neck. You allow the cerebral spinal fluid to flow. You make the blood healthy so it can hold oxygen. And you take the pressure off that brainstem. And you will get better. Absolutely. Absolutely. Question 2 from Brandy Lat 74. Diabetic here. No doctor or medical professional has been able to help me with this in 14 years. That's understandable. How can I get my body used to a normal blood sugar instead of feeling like I'm having a low one? I get to 125 and my heart starts pounding. 3 things. When you're looking at diabetes, okay, 95% of all diabetics are type 2. And that has to do, if you look at it, about energy production. So obviously diet is going to have a contributing factor for sure. But when the blood sugar gets to 125 and the heart starts to pound, there is something a heck of a lot more important going on here than just the diabetes. So when we're looking at this, look at energy in the blood. And the job of insulin is to get energy out of the blood and into the cells. So the 3 things we got to fix on you: physical, chemical, and emotional stress. Because if I'm just standing on your toe, causing you pain, that sympathetic nervous system, that automatic nervous system, is going to cause glycogen to be broken down to glucose. So blood sugar is going to go up. It has to. How's the sleep patterns? I guarantee that you're not waking up refreshed with tons of energy. And this is common. I mean, if you walk in a room and the lights are off, you're not going to call the power company, okay? You're going to look at the light switch first, then the breakers, then the light bulb, okay? So now look at excess energy in the blood. So that's going to be diet. So healthy, organic diet, okay? That means it's going to be vital. Look at your sleep patterns. Do the sleep restriction therapy to change that pattern. Look at physical stressors, because physical, chemical, and emotional stressors are going to cause that liver to break glycogen down to glucose, and blood sugar will be burnt. It'll be firing off. It's going to be increase its production. And then, since there's excess energy, look at exercise. As weird as this sounds, a half hour to an hour of walking, you're going to be burning up some of the energy. Look at the food you're taking in. So get to a good corrective doctor, one that's going to take an x-ray to look at the entire structure. And you are definitely, with the blood sugar issue, you have a problem resting, digesting, and repairing. You are in the fight or flight mode. And this is why doctors are looking at diabetes as some disease attacking you. And it's not. It's your body adapting to chronic stress. So you identify the physical stressors by getting an entire a structural assessment by a good chiropractor that's going to identify a problem, get a series of adjustments, and then fix the freaking problem. Then look at sleep pattern changes, and then look at reprogramming the emotional component. Look at healing the gut. There's more than likely going to be a gut issue. If you can do a live blood cell analysis so you can see the efficiency of the blood, that's going to make a big difference. You address all of those, and then your energy level and the blood sugar will normalize. The problem with a lot of medical professionals is they don't look at the causative factor. They don't look at elevations in blood sugar. Has the body adapting correctly to stress? They think it's a disease. Address the underlying stressors, and then your body will normalize. Oh, from Brandylat 74, question 3. What's the best, fastest way to lower inflammatory markers? Okay, let's back this up a little bit, okay? Because when you're looking at a blood test and inflammatory markers, inflammation is not a dragging attacking you. Inflammation is from tissue damage. Inflammation is a repair process. So if you word this question completely different, then you're going to be right on. But I understand this is how medical professors or professionals talk. They say, oh, you have elevated CRP, okay? You've got, some type of markers on there. They're not saying that this is a repair process. And in order to have inflammatory markers, you have to have some tissue damage. Because instead of saying inflammatory markers, and if they said tissue damage, then you would say, well, let's repair the tissue. That's how you reduce the blood analysis, which is only the fire alarm. You don't want to go down and reduce the markers. You want to allow inflammation to work. So number one, look at your gut health. If you're getting 2 to 3 healthy bowel movements a day, beautiful. I find that unusual if you have elevated or tissue damage and tissue repair, because tissue damage is going to put you in this fight or flight nervous system state when we have the rest, digest, and repair, the sympathetic and parasympathetic, where they should be in balance. But knowing that you have tissue damage, that's going to throw you in a stress response. Then look at anti-inflammatories. Okay. Now, the difference between a chemical anti-inflammatory is like paracetamol or acetaminophen or Advil, Motrin, Aleve, the non-steroidal anti-inflammatories. Those stop the inflammation process. So, one of the effects of those chemicals is it destroys the building block of cartilage. So it actually damages your cartilage production and can damage kidneys and do a number of other different things. Anti-inflammatories like omega-3s or vitamin C, that's totally different. Or juicing and blending. All of these have antioxidants that allow inflammation to work. You want inflammation to heal the tissue. That's what it is. It's not some dragon attacking you. So looking at the physical, chemical, emotional stress, but realize inflammation breaks down and builds up tissue. That's called an oxidative metabolic process. That process creates free radicals. And the anti-inflammatories like omega-3s, vitamin C, juicing, blending, all of those deactivate the free radicals to allow inflammation to work. So you want inflammation to heal the tissue. You just got to find the tissue damage. So look at your gut health, look at lungs, look at the health and efficiency of the blood, look at when your body regenerates, the poor sleep patterns. I'm sure that's going to be an issue. I doubt if you're sleeping good with 3 healthy bowel movements a day. No, this is a stress response. I address the physical, chemical, emotional stressors, and then the tissue repair. Then the blood test will go down. The blood test showing inflammatory markers. It's like, duh, that's the body responding correctly. Question 4 from Hishamasalam, 7895. Thank you, doctor. I live in Egypt. We hope you visit us. I would love to. Assalamu alaikum. Okay, I would love to see that. Oh my gosh. That we almost made it there in 2020. I'm asking, how much does it cost to visit your clinic? And have an adjustment plus stem cells and IV. I have Bertolli syndrome, back and neck pain, and brain and body inflammation. Okay, understand, it is not Bertolli's syndrome. What you're looking at is transitional segments, and you've got 3 areas. You've got transitional segments from the cervical to the thoracic, located right at the junction, the thoracolumbar junction up here, and the lumbosacral. And so you're looking at the transverse processes as being hyperplastic, where they're going to be asymmetrical. One's going to be larger, the other is going to be smaller. One may be attached to the sacrum or even the ilium. Okay, the other may not be. That is not the problem. I'm telling you right now, because so many doctors are going to look at the x-ray and say, oh, that congenital anomaly is there. No, it's been with you your whole life. And when you look at this, they'll say, well, the pain comes on when they're in their 25, 30s, or 40s. Okay, no, it's not that problem. If you made it a quarter of a century or 10 years with that issue, that is not the issue. Look at the entire structure. Loss of cervical curve in the neck, you've got to assess that. Lateral thoracic deviation, that's going to change the force loading on the lumbar. For sure, your sacrum's going to be unstable. So get a trochanter support. But when you look at our x-rays that we suggest, the lateral bending films, okay, the 5-degree cephalic, where we're looking at the cervical, thoracic, lumbar spine, static and stress x-rays, you assess the body like that correctly, you're going to find out that there's a pelvic instability. That's one of the contributing factors that I've seen 100% of the time with people with this diagnosis, because it ain't the diagnosis that's causing the problem. There's going to be loss of lumbar curve, guaranteed, and there's going to be a lateral shift of the thoracic or cervical spine. You address all that, then your body can heal fast. Now, what does it cost to visit us at our clinic? In the Huntington Beach office, it costs $250 US. And with that, we get the full x-rays, anything that I need, 3 different nerve scans, live blood cell analysis, full torso thermography, the report of findings, so you get copies of everything, and you get the adjustment for $250. Okay. Now, the clinic in Tijuana, it's $350 because you get all of that, the x-rays, nerve scans, thermography, blood analysis. But we also do a CBC or complete blood cell count. We also do digital dental x-rays because that is significant. There can be cavitations. There could be reactions from root canals or amalgam fillings. There's a lot of stuff that can toxify the body from the dental. So it's $350, and that includes the adjustment as well in Mexico, $250 in America. Now, stem cells, I don't recommend stem cells unless you fix the problem. And we have our own stem cell lab in Tijuana. But you've heard of some people getting the injections and not. So if you're injecting a joint, like the shoulder, elbow, wrist, knee, ankle, hip, any of that stuff, you've got to restore the nerve supply and restore the biomechanics. Then the stem cells work fantastic. To do the IV stem cells, so it's about, I think it's like $2,000, $1,500 a joint to shoot it. And this is the umbilical cord stem cells that we get from women that have not had the jab. And we have to reject about 6 out of 10 of the umbilical cords. And then we grow the stem cells from those. Now, the IVs, and also too, intravenous, it's, I think, 50 or 100 million. It's either 5 or 10 grand. And that is getting them in the entire system. But that includes that we have to do a blood analysis that costs us $450 to look for any tumor markers in the body. And if there are any tumor markers in the body, before you do the IV stem cells, we've got to do an ultrasound, if there are markers, of all the solid tissue organs to make sure that there's no actual cancer going on in the body. Because the stem cells are going to go to areas of increased metabolic response, and you want to make sure the body's healthy before you put it in. Now, the IVs run from $100, 60, 70, 80, $100. Like our chelation, I think takes 4 hours, and I think it's $120. And most of our vitamin, nutrients, and supplements, it's between $60 and $80, US. And you can give the call to the office anytime, and they can go over details. And you're gonna love California. I just had one of my friends visit, and she was born in Egypt. Very, very cool. Question 5 from Matt 81270. Do you have any videos regarding inguinal hernias, non-surgical solutions or treatments? Yes. Okay, I don't know if I have any videos, but I should. That's a heck of an idea for one. Inguinal hernia, you got to address and correct the thoracolumbar junction. You got to, if you compromise the nerves that supply an area, that area becomes weakened tissue. Then you have to look at the health of tissue production. So that inguinal area is coming from T12, L1, maybe T11 in that area. And so look at a structural or compromised nerve supply to that area. Then look at pelvic instability. Now on inguinal hernias, what you got to do, you got to approximate the tissue. So this way, a trochanter support, some type of belt, kinesio tape, maybe, but creating a back pressure is really important. So we'll give a trochanter support and fold up like a towel or a cloth to create pressure on that area. So while you're correcting the lumbar lordosis, and because that's always a contributing factor for inguinal hernias, and then changing the bowel movements, because if this person is dehydrated, they're going to be straining, and that straining is going to increase that back pressure. So look at the bowel movements, look at sleep patterns, and look at the structural component, and then that you've got a best chance for it to heal. And if you do not address the causative factor and just do the mesh or the surgery, it's not going to work. There's going to be some kind of problem. Now, if your question wasn't answered here, go to the Dr. B VIP site, and I'll respond to the rest of the questions there. Thank you. God bless you all, and share these questions and responses.